inside rehab, is an AA-based program, and they talk about the gift of desperation. I had not considered that I had hit rock bottom. We still had enough money to live. We had, our house, and my wife was now going to work. So we had health insurance, and I mean, everything was pretty much okay. We had saved really well over the years. So I didn't consider myself hitting rock bottom. So I didn't have the gift of desperation, but I did have the gift of willingness. And I will tell you that God was at work on the drive to the rehab program. And what I mean by that is, at this point, when you're in active addiction, my ego was through the roof. I mean, I thought that everything I touched turned to gold, which is crazy because no one goes to rehab on a winning streak, So still
Right.
the sick brain is at work telling me how great I am. But God intervened because I realized that I couldn't do this alone. I realized that I knew nothing about the treatment of addiction, and I was willing to put 100% trust in the facility to get me better. And it's a miracle that I came to that realization at that time in my life, because
You're listening to When God Intervenes, the podcast where faith, hope, and healing come together for families with a loved one battling addiction. Hey everybody, welcome to another episode of When God Intervenes. I'm your host, Daryl Rogers, and I'm here today with Brett Cordes. Brett is from Louisiana, from Baton Rouge, and we've just been chatting a little bit, getting to know each other. I'm going to read Brett's bio, a short bio here, just to kind of introduce him to you. Brett says, I was the typical overachieving, people-pleasing medical student, surgical resident, and young doctor who successfully built a thriving clinical practice within the Texas Medical Center. My career, as well as my personal and professional reputation, came crashing down as my hidden secret of opiate addiction was discovered and made public. My story continues through treatment and recovery, as well as the long and tortuous road toward regaining my medical license and ultimately working again. While tremendously grateful and humbled for this opportunity, I had to admit that my passion for clinical medicine had waned. I have since discovered physician coaching, and I'm inspired to help fellow doctors navigate the epidemic problem of physician burnout as well as substance abuse. All right. Welcome to the show, Brett Cordes. Good to have you here.
absolutely, I'm glad to be here. Thanks so much.
Yeah. So, wow, you're the first medical doctor or first doctor, I believe, that I've had on, and that's interesting. I really have a lot of respect. I know there's a lot of training that goes into that, and a lot of years, a lot of hard work and study, and so I get that. So, my hats off to you for being here and being willing to share your story with people.
Absolutely, I appreciate it.
Why don't we just start off with, let's backtrack a little bit. We'll kind of fast forward to what happened that kind of led to, how did the wheels all come off? So you went to medical school and you graduate and you started were you working at a hospital or were you in private practice?
Yeah, I was in private practice right out of residency. And, I'll have to, if you don't mind, I'll kind of start in my childhood briefly,
Okay.
because my upbringing, it'll make more sense how the wheels came off if you
Okay.
understand where I came from. But anyway, so yes, I was born and raised in Baton Rouge, Louisiana. And my dad, and I had a pretty normal childhood, pretty normal upbringing, no blatant or overt childhood trauma or anything like that. But my dad was a mathematician. He was a PhD and taught advanced mathematics at Louisiana State University. And my mom was an English instructor also at LSU. And I have a sister who's 10 years older than me. She is an attorney that now works outside of Chicago, but she worked most of her career in New York City. So the point of all that is that I was raised in a heavily academic household. Academics, high achieving in school was a very, very high priority with me growing up. And I felt, my sister was salutatorian of her high school. She was number one in her law school class. So I felt by the time I was 7 or 8 years old, I felt like I had to excel, that I had to be the best. And certainly I had to do my best. But honestly, I had to be the best just to feel like I'm fitting in with the rest of my family, just chatting around the dinner table. But I do want to kind of underscore that my parents never directly told me, you have to make all A's, or you
Right.
have to, we want you to be the best player on the basketball team. That it was never like that. The pressure that I felt was self-imposed.
Mm-hmm.
Um, but nonetheless, I ended up kind of equating love and self-worth with achievement
Uh-huh.
and accolades and success, because I would get heaps and heaps of praise when I did well in school or did well on the athletic field. I was a fairly good athlete growing up too, and I never got punished or anything for not doing that, but I just learned to equate love, self-confidence, self-worth with achievement. And so that's going to come into play later on when my addiction, begins to take hold.
Mm-hmm.
But I went to LSU for college, and my major was history. I had absolutely no idea whatsoever what I wanted to do with my life. Most of my family were academicians. My sister was an attorney. We had a few other attorneys, but no one in the family was in healthcare. No doctors, no nurses, no therapists, nothing like that. So I majored in history simply because I enjoy the subject. And at the tail end of my freshman year of college, I did very well. I had a 4.0 grade point average. But in the last 2 weeks during final exams, I was diagnosed with non-Hodgkin's lymphoma, which is cancer of the lymph nodes. And that was a shock, obviously. And I could talk a long time about this, just one subject, but I'll tie it up pretty quickly. But it was a 16-month battle with cancer because I was treated for 4.5 months with chemotherapy. And when I was halfway through my radiation therapy, the cancer returned. And then I really had to pay attention. I was in full-blown denial prior to that, being an invincible 19-year-old, college kid. But ultimately, the battle extended out for almost a year and a half. I ended up having a stem cell transplant at MD Anderson in Houston, Texas, and then another 6 months of therapy. So it was a very, very long road. But a silver lining that came out of it, honestly, there were several silver linings, but one of the bigger ones is that I decided I wanted to be a doctor. So I added pre-med to my schooling major and whatnot, and went to medical school and became a physician directly due to my experience as a patient over those years.
Wow.
So that's what inspired me to be to do what I'm doing.
Wow. Wow. It's a lot for anybody to go through, having to battle cancer, and particularly a 19-year-old, that's huge. I just can't imagine that.
Yeah. Yeah. It was a lot. I had to grow up very quickly.
Yeah. I can imagine. So, and what sports did you play?
Let's see. And when I was prior to high school, I played basically every sport imaginable. But in high school, I ran track and I played basketball.
Okay.
And I also played volleyball. So those,
Okay. You must be tall.
well, I'm 6'2",
Okay.
but my dad is 6'8". He
Oh,
played
wow.
college basketball at Stanford.
Oh,
So
okay.
I'm actually, I thought I was
Short
going
in
to be a six
comparison.
nine point guard. Yeah,
Uh-huh.
but I'm short
Yeah.
compared to him.
Yeah, I get that. So, all right. Well, so you get through your childhood. We're talking about that a little bit, and then you're off to college, and then this battle with cancer, and you come through that, and that's inspiring you to move into the medical field. So, what's next? How did things transpire after that?
Well, what's next is medical school, and I had a fairly uneventful 4-year run there.
Mm-hmm.
I will say, and this is important, but my first exposure to opiates, and opiates, there are painkillers for any listeners that that don't know that. So my first experience with opiate narcotic pain medicine was during my cancer battle. Lymphoma wasn't a painful cancer for me, but I did have several surgeries and several biopsies for which I needed pain medicine. And I liked the way the pain medicine made me feel. I didn't love it. I remember thinking that it felt like two or three beers, a two or three beer buzz, but it wasn't anything to write home about. I wasn't thinking about the pain medication when I wasn't in pain. It never occurred to me to take more than one or two as needed. So that is important to keep in mind, that was my first exposure. So 4 years of medical school in New Orleans, and then I matched into ear, nose, and throat surgery, head and neck surgery in Houston, Texas at Baylor College of Medicine. That's 5 years of training, also fairly uneventful. And then I stayed on and started private practice inside the Texas Medical Center. And for those who don't know, the Texas Medical Center is the largest medical center in the world. It employs over 100,000 people alone, just the medical center. Wow. And we were one of only two private practice ENT groups. So we were extremely busy. And so I was able to build my practice up very quickly. Within a year and a half, I was already at 100% capacity. And I absolutely loved it. It was everything I had ever dreamed of. I was working very, very hard, but ENT doctors, we're not up in the middle of the night dealing with gunshot wounds or whatnot. Right, so working hard is about 55 hours a week. Okay. So I still had time. I was coaching my kids' soccer teams and t-ball teams, and my wife and I were going to church every week. I had plenty of personal life outside of medicine. But so this continued for about 5 or 6 years. And at about 5 years, I started to experience what I thought at the time was boredom. And I will say, in retrospect and through a lot of self-awareness that I was able to develop in treatment, I was really experiencing a lack of fulfillment. But at the time, I felt kind of bored. I had been climbing this mountain my entire life, going to school, getting good grades, doing well on tests so I could go to the college and then go to medical school and then match into the right residency. And everything was about doing well academically, doing well in my training so I could go to the next step. I'm at the final step. At this point, I'm 5 years into private practice. Kids are healthy, marriage is strong, going to church, everything is really going well. And really the only thing I could think of when I stopped to smell the roses was, okay, what's the next challenge? I was not able to enjoy the present time. And that's something that I'll talk later. To me, is really something that has come to define my recovery, which is enjoying the present time. But so I thought I was bored, and that turned into some kind of depression and anxiety. And specifically what I was feeling was kind of a sense of powerlessness. I just didn't feel like I had any power or say in where my life was going. And again, because I was lacking fulfillment at work, I started looking for distractions. And so my usual routine on Friday afternoons would be to come home. My wife and I would sit out by the pool. I would open up a couple of beers, and we would, sit and talk about the week and look forward to the weekend and relaxing. And that was our Friday afternoon routine. Well, on this particular Friday, a drug rep brought in some hydrocodone-based cough medicine, which is an opiate based cough medicine. And when she rounded the corner and I could see what she was going to leave, these free samples, the first thing I thought of was, hey, I know how that feels. That's like a nice beer buzz right there. And I thought it would be a good idea to take one of those cough medicine samples home that Friday afternoon and take that instead of my two beers. Why not? What could it hurt? Was my thought process. But the difference this time is when I took this cough medicine on my way home, I experienced a euphoria that I had never experienced in my entire life, and I have since never experienced since then to that degree. It was mind-blowing. It was an earth-shattering, perspective-changing feeling. It was something. It is indescribable. And, this is the exact same medication that I took 25 years previously when I was sick with cancer. So it's interesting that, genetics and the physiology of medication is not all that's at play when we talk about addiction. But that one decision to take that little cough medicine sample eventually led to a 6-year progressively increasing and then worsening full-blown addiction to painkillers.
Wow. Yeah, I've had a few experiences myself with, never had any kind of addiction issues or anything like that. But for different reasons, I've had to use some painkillers, opiates in the past. I had some oral surgery one time, and so I'm using these pills as prescribed, and it's like wonderful in terms of the relief from the pain comes so quickly, and but then after a little while, my body was beginning to build up a tolerance,
Mm-hmm.
and that one pill was not giving me the same relief that it was in the past, and so I split another pill. So I took 1.5, and just that difference, I don't know, it just made me feel really bad. I had like an out of body kind of experience, and it was, and then I had this like kind of a dull headache the rest of the day. It wasn't a pleasant experience for me, that particular thing, but that was it. I was like, I'm done with that. I'm not taking any more of those.
Yeah. Well, the way I describe it is with opiates, with
Mm-hmm.
painkillers, roughly a third of people actively dislike it. So they have a
Okay.
reaction like you did, or they get
Uh-huh.
nauseated, or they're itching, or have some sort of allergy. That's a third of people. A third of people like it, like I did when I was battling cancer. So it works
Mm-hmm.
with the pain. It makes you feel pretty good and relaxed, but no big deal.
Mm-hmm.
And then another third, it actively feels good, and
Yeah.
people are kind of disappointed when they're done with the pain because they like the pill so much.
Mm-hmm.
Um, and then about 10% of that population will actively try to get more pain medication through their doctor and whatnot. They're not going to go to the streets or anything, but they'll try to go to their doctor. And then about 5% of that 10% of that third become addicts because of the mind-blowing euphoria and the
Mm-hmm.
void that feeling was filling.
Mm-hmm.
So it's I just thought that was interesting, those percentages.
Yeah. So things kind of fell apart with you. So you experienced this euphoria using these opiates, you said it was like a cough syrup, right?
Mm-hmm.
That was your initial. And so you experienced that. And so I guess you immediately, or maybe the next day or pretty soon afterwards, you're like, I need some more of that.
Yeah, so this was a Friday afternoon, and so I didn't go back to the office until the following Monday,
Mm-hmm.
and it was a very, very controlled, slow progression,
Mm-hmm. Mm-hmm.
which I have been told by several people in the addiction world and my counselors that that's pretty unusual. But it took about a year and a half for
Oh,
me to
wow.
get to where I was using opiates every day throughout the day.
Mm-hmm.
Um, and at about 2 years, I was having to use them whether I wanted to or not, just to stave off the withdrawal symptoms.
Yeah.
So I was a daily opiate user for about 3 years, if I'm remembering correctly. And yeah, long story short, coworkers, my partners, found out that I was a daily opiate user, and they fired me. They called me into the office and initially told me to take a week off while they kind of investigate things, because all of our prescription writing was on the computer. They wanted to make sure I wasn't prescribing to myself, which I wasn't. And so they were not satisfied with what was going on, and they fired me. So I lost my job. This was in April of 2019. And then COVID hit the following year, and I went to treatment. I went to a 90-day residential treatment facility starting in July of 2020.
Okay. You mentioned the withdrawal symptoms. You had to continue taking the opiates just to stave off the withdrawal symptoms. What were those like?
Yeah, so opiate withdrawal, I commonly hear that it's like the flu but worse.
Hmm.
And a lot of people forget how bad the flu actually feels. The flu is horrible. It's
Yeah.
so much worse than a common cold. But for me, the withdrawals were just almost a panic-stricken anxiety, cold sweating, muscle aches and bone aches like the flu, runny nose, sneezing, coughing, and just feeling like you want to crawl out of your skin.
Hmm. Hmm.
It's pretty intense.
Yeah, I can imagine.
Yeah. And so, I mean, the amount of mental gymnastics that I had to do to justify being a drug addict and treating patients and operating on patients, those mental gymnastics were pretty intense.
Hmm.
But I honestly believed that I was a better doctor, that I was a better husband, that I was a better dad, I was a better everything when I was high on opiates.
Hmm.
I believe that. And then it became a little bit easier when I had to take them to avoid the withdrawal symptoms, because I was definitely a better surgeon and doctor when I was not actively withdrawing than when I was on the medication, because I
Hmm.
stopped getting high per se around year 3. But yeah, it's the justification and the rationalization that went on in my brain is it's hard to comprehend.
Yeah. Yeah. Yeah, and I've seen that firsthand, and yeah, I guess I get that, and we all do that with different things, from time to time. We tend to justify things, but yeah, when you're impaired like that, you just can't. I mean, you're just so far removed from reality. Uh, it's interesting that you're an ENT because when I was 16, I broke my nose playing a backyard game of football, and I ended up having to have surgery on my nose. I went to I went to the ER the first time, and he just like applied some pressure and reset everything, but it moved around, and I wasn't happy with the results as a 16-year-old boy. So I had some surgery on it, and I still have some calcium deposits to this day. Where he used the chisel, but yeah. Oh, and I had a little trouble equalize. I was a pilot too, and when I was taking my flight training early on, I was thinking about getting tubes. Because my eustachian tubes, I was having a hard time equalizing the pressure. But somehow I adjusted to that over the years and was able to tough it out. So your coworkers kind of came down on you, and you got fired, and you said you went to treatment. You went to a 90-day program. And what was that experience like? What was it like in treatment? I mean, when all of that happened, were you ready to go to treatment, or were you somewhat resistant? How did you feel about all of that?
Yeah, that's a great question. Initially, when I got fired, I knew that I was a drug addict at this point, and I knew that I was not going to have access to the medication anymore, because what I was doing is I would have my patients bring in any leftover pain medication that they had, and then we would destroy it. We would put it down the lab sink or dispose of it for them safely. And so after a while, I stopped disposing of it and used that as my supply. So I was using patients' old leftover pain medication, and obviously not going into work, I lost access. So I had to deal with opiate withdrawal for the first time long term. And that took about 12 days. And so I figured, okay, well, I'm cured. I'm basically cured. And realized at about week 2 that was definitely not the case. And so again, COVID hit, which worsened the isolation. And so when I went to rehab, I knew that I needed it. I knew that I could not stop on my own. I knew that if I ever had access to it, I would go back to it immediately. And I had also kind of started drinking a little bit, which was, for me, it was nothing like the opiate high, which is what I was striving for.
Mm-hmm.
And it really barely was enough to satisfy that change of emotional input. Um, but so I was willing and able to go to rehab in July of 2020. And inside rehab, is an AA based program, and they talk about the gift of desperation. I had not considered that I had hit rock bottom, You still had enough money to live. We had, our house, and my wife was now going to work. So we had health insurance, and I mean, everything was pretty much okay. We had saved really well over the years. So I didn't consider myself hitting rock bottom. So I didn't have the gift of desperation, but I did have the gift of willingness. And I will tell you that God was at work on the drive to the rehab program. And what I mean by that is, at this point, when you're in active addiction, my ego was through the roof. I mean, I thought that everything I touched turned to gold, which is crazy because no one goes to rehab on a winning streak, you know? So still
Right.
the sick brain is at work telling me how great I am. But God intervened because I realized that I couldn't do this alone. I realized that I knew nothing about the treatment of addiction, and I was willing to put 100% trust in the facility to get me better. And it's a miracle that I came to that realization at that time in my life, because ordinarily my ego would have prevented that. So I believe that my higher power, which is God for me, was starting to go to work before I even got to the rehab facility. But I had a tremendous experience there. 12-step based, lots of individual and group psychotherapy. And I realized very early on that I have more in common with most of the guys that I met in rehab than I do in the outside world with my colleagues. From a personality standpoint, people talk about an addictive personality. I'm not a real big fan of that term. I'll just say that I meshed very seamlessly with meth addicts, heroin addicts, alcoholics, people even from synthetic marijuana and mojo up to bath salts. I mean, all this crazy stuff that you hear about. And once we all get sober and we're all feeling emotions for the first time in a while, we discover that we have a lot in common. But I learned just a tremendous amount about myself, what motivates me, what demotivates me, why I was using, what my emotional triggers were. I kind of came to this is the way I describe to non-addicts, because it's really impossible. I have found I don't have the words, I don't have the vocabulary to explain addiction to non-addicts. But so this is the way I describe it, that even heavy drinkers drink to enhance the emotion that they're feeling. So you go to a football game, you drink because you want to enhance happiness and having a good time. But addicts drink and alcoholics drink to change the way that they're feeling. They either want to avoid an emotion or they want to completely numb that emotion. And so for me, that's been a quick and easy way to kind of describe the difference between an addict personality and a user or recreational drinker.
Most people have some type of trauma. Not everyone, and trauma is different for different people, right? But most for you, it was more along the lines of how you were internalizing. There was a perceived pressure to perform academically, whether it was real or perceived, or it doesn't really matter. It's how you internalized it, and so you felt that pressure there. And I'm unless there's something else you haven't told me about, I'm picking up on that. That was the main driver, that it was kind of a stressor for you. And so the opiates sort of numb that feeling whenever you were feeling stress or anxiety. Am I right on that?
Yeah, it was kind of a combination of that and then external validation. In other words, acquiring self-love through achievement.
Right.
And after working for 5 years, all the good jobs, all the attaboys, all the plaques and awards, that stuff stopped coming in. And so my self-worth started to decrease. And that led to this kind of helpless anxiety feeling. And that's what I was trying to numb.
Yeah. I get that. So, and my self-worth early on, particularly, was really attached to my flying career, which I gave up in 1990, but it had nothing to do with addiction. I just, I moved on to different things, and there's another whole story behind that. But certainly I get what you're saying there, that For me, I was struggling with a self-esteem issue. And so that was sort of my identity. I'm a pilot, and yeah, we can get off and headed in the wrong direction when our self-worth is all based on, our identity is based on our profession, or or on academics, or whatever it is, along those lines. So you went to treatment, and I can sort of understand, identifying with that group of people too. Even though I've never struggled with drug or alcohol addiction, I guess maybe I'm just not. Maybe I'm a little different than most people, but I collaborate with this group of interventionists now who are all in long-term recovery, and it's like, I like them. We just like, I feel like we mesh in so many ways. And I think I was sharing with you earlier before the podcast started, I just dropped off a young man at a treatment program yesterday. And there was like a dozen guys came out to the car when we drove up and met us there, and we're like unloading his luggage for him, and they're all smiles and welcoming him and everything. And I just stayed there and hung out with everybody for a while, and it's like I felt like I was one of the guys, I was one of them. And so something about me does mesh or does click a little bit. And so I can sort of get that. You felt like you were at home, right? I mean, among those people there.
Yeah.
Yeah.
Yeah, I really did.
So do you think, I think for a lot of people, I see that for a lot of people, maybe it's different for you. I don't know, coming from where you came from, but for a lot of people, the structure is really important. The structure of like AA or the 12 steps, or any type of treatment program, having that structure in place is really important for a lot of people. I find that a lot of people, when they don't have some pretty rigid structure in place and have too much freedom, they tend to wander off in the wrong direction. I don't know. Is that a fact? Has that been a factor for you or no?
Oh, 100%. Yeah. Yeah. Like I said, my rehab facility was AA based, and the entire day was scheduled. I think we woke up, had to be up, and we had morning prayer at 6:15, exercise from 6:30 to 7, did chores from 7 to 8:30, AA at 9, community at 10, and then therapy for the rest of the day. And so routine, having even small responsibilities early in the day for me is key, because you're accomplishing something right off the bat. And I am very goal oriented. So if I can make my bed and then look and see this nicely made bed, well, I'm already up one on the day. I already feel like I've accomplished something. And I had to return to rehab after 3.5 years. I'll tell that story in a little bit.
Okay.
But one of the signs that I was starting to slip was that I stopped making my bed in the morning. And I think that sounds kind of silly, but it starts slow, to get out of the 12-step language and into some of the psychotherapy language. You emotionally relapse before you mentally relapse, before you physically relapse. And for me, not making my bed, not going to the gym, not doing some of these more menial tasks, that is a sign that I'm starting to emotionally relapse.
Yeah, there's a man out there, is a retired Navy SEAL, an admiral, that wrote a book called "Make Your Bed."
Oh yeah,
yeah, you've seen him.
I have.
Yeah, and he gave a whole speech about that, and then he wrote the book, based on the speech. But it's a simple concept, but it is really important. I get it, that you having that one task at the beginning of the day every day and completing that task, it just starts the day off right. So you have that structure, in place. Yeah, I get that.
And it's different for different people. Some people, their bed making is praying or meditating,
right,
or exercising. Any sort of self-care. It can be different for different people.
I embraced a thing a while back, and I've kind of fallen to the wayside a little bit now. But I still have structure in my life, but I do want to get back to this. It is called the Miracle Morning. I don't know if you've ever heard of that before, but there's a guy, a gentleman out there. His name is Hal Elrod, and he created this whole morning routine. And he calls it the Miracle Morning. And it consists of, I don't even know if I can remember. It was SAVERS is the acronym, SAVERS, silence, affirmations, visualization, exercise, reading and scribing or journaling. And it's a pretty good little acronym to use to just go through a daily morning routine to get your day off to a good start. And I've really enjoyed doing that over the years. But you just made me think about it, when you're talking about the structure and making your bed and all. But okay, so you go to treatment and you come out, and how are things when you first come back from treatment?
Yeah. So, treatment, and again, I hesitate to say that I loved treatment,
Uh-huh.
uh, but it was what I needed and it was extremely useful.
So
Um,
I'm sorry to interrupt, but you did the 90-day program. Did you step down after 90 days into like a sober living house or anything like that?
I did not.
Okay.
No. Yeah. At that facility, if you complete a 90-day program, that's complete.
Okay.
And every now and then a 90-dayer will go into sober living, but not if you have a spouse and a family to go back to. You have a
Right.
support
Right.
structure
Yeah.
to return
Yeah.
to.
Hmm.
Yeah. And so, but rehab is a bubble. It's a safe bubble. You can't get access to your drug of choice. You've got this routine that is spelled out for you. You're being held accountable for every little thing. And when you step out of that, it's it's a little scary,
Yeah.
because you realize that once you step out what freedom truly means.
Mm,
And for a drug addict or an alcoholic, freedom can be dangerous and idle time can be very dangerous.
mm, mm.
So I was timid and I was cautiously optimistic when I was leaving rehab. But yeah, I got directly plugged into a local AA group and I did 90 meetings in 90 days. So I did a AA meeting every day for 90 days. And being a physician, I had to sign a monitoring contract with the Texas Medical Board. So I had to check in every day. I had to do at least 16 meetings a month. I was randomly drug tested. And to me, that was a disadvantage. And what I mean by that is I had to go to AA meetings, whether I wanted to or not, as opposed to going to AA meetings because I felt like I wanted to or I needed to.
Mhm.
Um, and for me, that was more than just semantics. I really began to resent my monitoring agency because I felt like they were hindering my recovery.
Mhm.
But
Mhm.
I enjoyed AA. AA
Mhm.
was fantastic. Even though I was an opiate addict, I felt like I was also an alcoholic and I felt at home at AA.
Okay. So you did speak about being emotionally sober earlier, versus, I mean, I see people who will go to treatment because they're jumping through some hoops. I call it jumping through hoops. They're not really there to do the work. They haven't committed yet. They're just like, well, I have to do this to be able to keep my job, or I have to do this to stay out of jail, or to make my family happy, or whatever it is. But they haven't really committed to the process. And a lot of times they return to use, pretty quickly after returning from getting out of treatment. Can you speak to that for a minute?
Absolutely. Yeah, I agree with that also 100%. Um, you know, I hesitate to give advice, but I will say, in my personal experience and from others that I've experienced in my 2 stints in rehab, you almost have no chance of long-term success and recovery unless you're internally motivated to get
Mm-hmm.
better.
Mm-hmm.
Um, if you're being made to go or required to go, and now two things can be true at the same time. You can
Yeah.
both be made to go and also internally motivated.
Mm-hmm.
So
Mm-hmm.
I want to make sure people hear that.
Yeah.
But yeah, you've got to want it. Recovery is hard enough, even when you do have the gift of desperation and you are highly, highly internally motivated. it's still extremely difficult, and it's darn near impossible if you're not doing it for the right reasons.
Yeah. Yeah, and I'm glad you mentioned that one piece there, because a lot of times families will say, "Oh, well, an intervention won't do any good because he doesn't want to go to treatment." But it's rare that it's rare that I've run across anyone that wants to go to treatment. But when they get there, I mean, it can be a lifesaver. It can save their life, because a lot of times once they get into treatment, they will buy into the process at some point, and
Yeah.
and get
Yeah,
better. So.
it's the old adage of fake it till you make it, you know.
Mm-hmm.
You have to go, so you go, and absolutely you can develop an internal motivation
Mm-hmm.
while you're in there.
While you're there,
Um,
yep.
so I would encourage, that's one of many excuses that a drug addict or an alcoholic will give for not, for not going. I don't want to go. I don't want it. So it's pointless. And for
Yeah.
any parents out there, I would consider that just one of many excuses, because you can develop that motivation while you're in there.
Mm-hmm. Mm-hmm. I talk to families a lot about boundaries, because I see in a lot of cases there's some enabling going on with family members, and they tend to keep their loved ones stuck in their addiction based on their enabling behaviors. And I was one of those people. I was one of those dads that was doing that. I was doing more rescuing and detective type work and that kind of stuff, than I was. But I was doing some enabling too. And certainly I would say there were a lot of controlling behaviors that I was engaging in, attempts to control. And I always tell people, there's only one person you have any control over, and that's yourself, and so if you're feeling that urge, you have to turn that attention inward and work on yourself, because the more you try to control your addicted loved one, the more tension is going to come up there, and the more resentment there's going to be, the more the relationship becomes dysfunctional. It just makes everything worse, But it sounds like your boundaries were more along the lines of from a professional standpoint, that it was just kind of a natural consequences, or were there any other boundaries that were put in place by family or friends or anything?
Oh yeah, I had plenty of boundaries put in place by my wife.
Okay. Okay. I
Yeah,
was wondering about that. Okay.
my wife had some boundaries put in place, and the biggest one was an ultimatum about going to rehab. And I immediately agreed, because again, that kind of coincided with my realization that I needed it.
Mm-hmm.
Um, but as an addict in active addiction, I walked all over everyone's boundaries. And the way it is for a lot of alcoholics and addicts, you violate the boundaries of those that care about you and those that are closest to you the most. And I don't know why that's the case. I don't know why I participated in that behavior, but it certainly was the case for me. Enabling doesn't even exist unless you care for someone. If you don't care about
Right.
someone,
Yeah.
you're not going to have any difficulty in not enabling them. So um,
Mm-hmm.
I don't know what it's like to try to parent or navigate a relationship with an addict that's a loved one. I can only imagine how difficult it is to try to control behavior that you can't control,
Right.
and
Yeah.
to be being manipulated all the time and gaslit. And it's just, I have a lot of empathy for my wife. Let me put it that way.
Mm-hmm. uh, yeah. Yeah. I would say that most parents, and speaking as a parent, it's a helpless feeling. Is helpless and hopeless. Those are the two words that I hear the most often: helpless and hopeless. And certainly you get a lot of anxiety around things, and a lot of worry, chronic worry. But what I found is that for families who are in that headspace, if they can, it really helps to be able to get back to focusing on their own life and setting their own goals, and so that they can not be so hyper focused on their loved one who's battling addiction, and get involved in self-care like you were talking about earlier. The self-care is really, really important for family members as well, to help them to be able to fight those urges of attempts to control. And also, and really that's almost an addiction in itself. I mean, the family has a lot of the same things going on, but kind of on the opposite end of the spectrum. The family members do, and you can really, as a family member, you can really become addicted to the drama that goes along with everything. I mean, life can be boring at times, just going through the day-to-day monotony. And now you have all this drama with this loved one battling addiction, and it's exciting. It's not exciting in a fun way, but you get what I'm saying when it comes to that.
Absolutely.
Yeah,
Absolutely. Yeah.
yeah.
Addiction is a family disease for sure.
Mm-hmm.
Yeah.
Definitely is. So, so did you say there was a relapse? You had a relapse at one point?
I did. About 3 years into it, I dabbled with kratom, which, for those of you that don't know, kratom is a legal over-the-counter herb that can mimic the effects of low-dose opiates. So I dabbled with kratom for a little bit, and it showed up on my drug screen. And so I actually had stopped it on my own for a full 2 months before I went back to rehab. I had to go to rehab because my monitoring agency required it. And so I went back to rehab when I was 2 months sober, and it lasted for 6 weeks. And it was a little bit of a different experience, still useful. I didn't find like I learned quite as much the second time through, mostly because I had already weaned myself off of it, and I wasn't in active addiction. So, but yeah, that's what my relapse looked like.
Gotcha. And so you've talked about your wife a little bit in her boundaries and everything. So with a lot of people that I talk to who are battling addiction or on the other side of it in recovery, they're a lot younger, a lot earlier on, when a lot of this happens, and it's more the parents setting the boundaries, but so being a little bit older and being married and everything, it's a little different dynamic going on here with your parents, but than maybe for some people. But how did your parents take all of this? Where were they in all of this?
Yeah, I will answer that question in a second, but let me say first that, and I'll speak to my personal experience, but I have a feeling other people can relate. But one of the reasons it was so difficult for my wife is that it turned into a parent-child relationship almost. She being the parent and me being the child.
Mm-hmm.
And, for our marriage, that was not healthy.
Right.
So for anyone out there who feels like the marriage turns into that style of a relationship, I can tell you that I can relate. I had 100% hidden my addiction from my parents. So it helped being that I was living and working in Texas and they were in Louisiana. But we still saw my parents at least 3 times a year at Christmas and Thanksgiving and whatnot. And I would have to be actively using, when I went and visited them. But they were completely blindsided when I called from rehab to tell them what was going on.
Mm-hmm.
And they did admit, they did know something was off. They couldn't really put their finger on it, but they could feel kind of an emotional detachment, if you will,
Mm-hmm.
or at least an altered sense from me for a couple of years. So, but they certainly didn't know that it was a drug addiction.
Okay.
But they were supportive. They were very supportive.
So you did 6 weeks, you said, the second time in
Yes.
treatment, and so you've been in recovery for how long now?
So I've been in recovery
Coming out
total
of that.
out
Coming
of
out
the
of that
second
second.
one. Out of the
Mm-hmm.
second one, I've been in, let's see, 15 months.
15 months. Okay.
Yeah.
Okay.
But I was 2 months sober going in, so it would be more 17 months from a sobriety standpoint.
Mm-hmm.
Um,
Okay.
and it's obvious to everyone that I used to count my sobriety days, and I
Mm-hmm.
don't do that anymore. It works better for me if I don't count because it's a permanent situation. So this is a disease that I'll have for the rest of my life. So for me, it doesn't help to count my sobriety days.
Right. Yeah. Yeah, I get that. Well, I'm glad I bumped into you. I really am. You got a really, really interesting story. And I'm glad you're sober and you're in recovery now and moving ahead with your life. What's life like on the other side now? And when I say on the other side, I know, like you mentioned, it's something that you'll be dealing with right on. But how does it feel to be in recovery, and how has everyone around you adjusted to this new life now?
Yeah, well, early recovery, my therapist would say that an addict or alcoholic in early recovery should treat it like it's a newborn baby, you
Mm.
know. So you're in the bubble of protection in rehab, and then in early recovery, you need, and this is my therapist talking, you need to surround yourself with people who have your best interests at heart. Surround yourself with a support system, go to meetings regularly. And so that's what I did. But it was like I had stated before, I was cautiously optimistic coming out the first time. And it was embarrassing coming home. I had a lot of shame and guilt that I worked on and eventually was able to conquer. But one example is one of my character defects is emotional immaturity. I mean, I had the emotional maturity of like a 16-year-old boy, basically. This was as a 40-year-old practicing surgeon. And so when I look back, recovery, I've improved on all these character defects. In the way that life works now is when a conflict arises, my natural instinct is still to deal with it the way I used to. But I have these mechanisms and these tools in place to be able to, and have learned not to go with those and to go with the new ones. But it's interesting that, and I don't know if this will last forever. There's only one me, so maybe it will, maybe it won't. But my initial flash instinct is still the unhealthy variety. Um, but the tools I've acquired have allowed me to take the right road and make the right decision most of the time.
I can really identify with that because I think I would say, in some respects, even though I've never had any kind of drug or alcohol addiction problem or anything like that, in some respects, I matured a little bit later emotionally, because I've had to learn to fight my instinct to react in certain ways, and very late even I have learned to get better control of my emotions. And I would say for me, what I see with parents dealing with a child battling addiction is they lack emotional control a lot of times because they allow their worry and their fears about their child to cause them to fall victim to these manipulating behaviors. And with me, I think a lot of the emotional and spiritual growth has come from, losing my son. I was able to say, well, what can I do with this pain? Because it's not healthy for me to have this pain and these thoughts that I'm having, some very unhealthy thoughts. And how can I change that? And I was able to internalize that. And that became a motivator for me to change so that I could mature more emotionally. I don't know if that makes sense or not, but then yesterday, I was just sharing with you before we started the podcast, I dropped off a young man at treatment. I had done an intervention for him like a week earlier, a little over a week earlier, and he was going and then he wasn't going, and it was back and forth, and his emotions were all over the place. And he ultimately did not go the day of the intervention to treatment, but then within a couple of days, he got into some legal trouble. And so I, was there to pick him up from jail and take him straight to treatment. But he was so happy to see me. But he even told me on the ride there, he shared with me, he said, I'm emotionally immature because of my early drug use. And I said, yeah, I see the emotional immaturity, but you have a very high IQ. I mean, I can see it's a totally different thing, right? He's extremely intelligent, and yet emotionally, he's kind of operating at the level of, he's 28, he's operating at the level of a 13, 14, 15-year old. But I believe, based on what I've seen with people in long-term recovery and just knowing what little bit I know about the brain, that it has the the ability to bounce back from the substance use. The brain is amazing, and to mature and to get to a place where emotionally you're where you should be, that you're linked up with your biological age and able to function better in society. It's good that you have those coping mechanisms, those healthy coping mechanisms, those tools now. But I believe that you'll get to a place where, you won't have to completely rely on those tools anymore. It'll just become, you're going to create new neural pathways that will allow you to function that way. Does that seem to match up with, does that make sense?
Oh, yes, it makes sense. Not when a conflict arises, I don't have that initial flash instinct across the gamut of
Right.
my character defects.
Yeah.
But I will say, something that I have found I have in common with a lot of addicts and alcoholics is, like we discussed, emotional immaturity and inability to regulate emotions well. That's one. Number two is an extremely low threshold for frustration.
Yeah.
So I thought that was unique to me before I went to rehab. But a lot of people in recovery, I have come to realize, especially when they're in active addiction, they have almost no threshold whatsoever for frustrated. If something doesn't go right or they don't get something right immediately, and then that's coupled with the emotional immaturity. So, that's all a bad temper is. A bad temper is just emotional immaturity. It's like
it really is.
It's like a 3-year-old throwing a tantrum in an adult's body.
Yeah.
And I used to do that all the time.
Yeah. Well, I'm right there with you. Yeah. I used to have a really bad temper, and there's times now where it's still, kind of lurking. If I'm driving somewhere and somebody cuts me off or they're just intentionally rude, I feel it. And I'm like, no, I got to fight that. I got to fight that emotion, but I think most people struggle with some of those feelings, right on for quite a number of years, maybe almost for life. But, you learn you learn as you get older that, okay, those responses are unhealthy and they don't get me what I want, and they're not really good for us. And so we have to learn how to manage that. And I do believe that over time of practicing that it gets to a point where it's almost second nature and you don't even have to think about it anymore. I can equate it to like riding a bicycle or learning to fly a helicopter. I haven't flown a helicopter in many years now, but I spent enough time flying helicopters. I know I could get in a helicopter right now, and I might be a little bit rusty, but I could pick up a helicopter and hover it, just because I built that muscle memory. And so it's the same sort of thing. Over time, you can learn to sense that frustration coming on, sense that, those unhealthy emotions bubbling up, and it just, you automatically learn how to deal with it. Brett, what kind of advice would you have for parents out there maybe who are struggling with a loved one battling addiction?
Yeah. Well, obviously, I'll answer this from the perspective of the addict, and I'm thinking of my wife and my parents here. But my first piece of advice would be to allow some empathy for yourself. Enabling is an exhaustive exercise. And even though I didn't experience myself, I watched my wife and my parents. And so I would say, have some empathy for yourself and remember that it's only possible to be an enabler if you love the person that you're dealing with. And so rarely is whether you love this person in question. It can be extremely painful to have to cut someone off. But ultimately, and again, I wasn't going to get better unless I went to rehab, unless I had help. And I realized that. I didn't realize that for several years, but I did realize it eventually. And then I guess my second piece of advice would be, when all else fails, just do the next right thing. And that can be take a shower. That can be eat a healthy meal. When I've been in dark days, I divide my day up into 5-minute increments, and I just do the next right thing. In 5 minutes, next right thing. And then that eventually builds and builds. But when all else fails, I've found that that
is a good rule of thumb. I like that. Well, Brett, man, tell us about your coaching. I know you coach doctors now.
Yeah.
Tell us a little bit about that.
Yeah. So, when I kind of came to the realization that I had lost my passion for clinical medicine, I kind of through an episode of fate, I kind of got hooked up with life coaching. And then my niche of life coaching is other doctors who are experiencing symptoms of burnout the way I did. And again, in retrospect, the boredom that I was feeling in year 5, which was the lack of fulfillment, I now know that that is an early symptom of burnout. So my goal is to be able to coach other healthcare workers and providers through their burnout so that they can kind of rediscover the passion of the profession, and also in their personal life. Because when anyone is burnout, doesn't have to be a doctor, but when anyone is experiencing burnout, whether it's professional burnout or burnout from parenting or whatnot, it affects your personal life too. So I did and made almost every mistake humanly possible when I was burning out. And so I'd like to try to prevent that from happening to others. It's just it's all done on Zoom, and it combines kind of the principles of the psychotherapy of recovery with the principles of traditional life coaching. So
okay,
that's what I'm doing.
So let's see, do you have a website?
Yeah, the website is theburnoutdoc.com, and I'm on Instagram and Facebook and LinkedIn. Again, it's the Burnout Doc is the best way to find me.
Okay, theburnoutdoc.com.
Yes, sir.
All right, Brett, man, it's been a pleasure having you on the podcast today. Thank you for joining me and sharing your story with my audience. I really appreciate it.
Absolutely. It was enjoyable. Thank you for having me.
Brett Cordes, thank you again.
All right.
Thank you for tuning in to When God Intervenes. If you found today's episode helpful, please subscribe and leave a review. Your feedback helps us reach more families in need of hope and healing. For more resources and support, visit our website at thefamilyrecoverycoach.com. Until next time, stay strong and keep the faith.